Bismillahirrahmanirrahim. The effect of insulin on fat metabolism are discussed in this video. While the effect of insulin on carbohydrate are more immediate and visible, its role in fat metabolism is equally critical in long term. Insulin deficiency can lead to severe atherosclerosis due to abnormal fat metabolism, increasing the risk of heart attack, cerebral stroke, and other vascular complications. Then there are acute effects of insulin on fat metabolism also. These are promotion of fat storage. The insulin helps in the synthesis of fatty acid and triglyceride, and it also inhibits the breakdown of stored fat and also decreases the circulating fatty acids. Insulin also reduces the release of fatty acid into bloodstream and lowers the plasma lipid level. Without insulin, there is excessive fat breakdown occur, releasing large amount of fatty acid, and this lead to abnormal uh, lipid profile, contributing to arteriosclerosis and vascular disease. Insulin promotes glucose usage in most tissue, reducing the need for fat oxidation as an energy source. This makes insulin function as fat-sparing hormone. Insulin is also responsible for fatty acid synthesis. If carbohydrate intake exceeds immediate energy requirement, excess glucose is converted into fatty acid. Most fatty acid syntheses occur in the liver cell. These fatty acids are packaged as triglycerides in the lipoprotein form, like very low density lipoprotein, and the liver releases these lipoprotein containing triglyceride into the bloodstream, and these triglycerides are transported to adipose tissue where they are deposited as fat reserves. So insulin ensures that excess energy from the carbohydrate is efficiently stored as fat, preparing the body for future energy demands. So, insulin increases glucose uptake by the liver cell. When liver glycogen it reaches 5 to 6% of the liver mass, further glycogen synthesis is inhibited. Excess glucose is diverted into fatty acid synthesis. Glucose is converted into pyruvate via glycolysis. This pyruvate gives rise to acetyl-CoA, that is the main substrate for fatty acid synthesis. Excess glucose metabolism in the citric acid cycle produces citrate and isocitrate, and this ions, these citrates and isocitrates, these activate acetyl-CoA carboxylase. This acetyl-CoA carboxylase, the enzyme that converts acetyl-CoA into malonyl-CoA, which is the first step in the formation of fatty acid. Fatty acids are assembled into triglycerides in the liver, and triglycerides are transported into the blood as lipoprotein or very low density lipoproteins, and insulin activates lipoprotein lipases. These lipoprotein, when they go into the bloodstream, the insulin activates lipases in the capillaries of adipose tissue. Lipoprotein lipase, it then breaks down triglycerides into fatty acid, and these fatty acids are then absorbed in the adipose tissue. Inside the adipose tissue, they are reconverted to triglycerides for storage. So insulin is a master switcher for fat synthesis and storage, ensuring excess glucose and energy. This excess glucose energy is sufficiently and efficiently stored as triglycerides in the adipose tissue. The hormone-sensitive lipase is an enzyme that hydrolyzes triglycerides that are stored in the fat cell, releasing free fatty acids into the blood. Insulin inhibits this hormone-sensitive lipase and prevent the triglyceride breakdown. So, as a result, there is reduced release of fatty acid from adipose tissue, favoring the storage of the fat. Then, insulin also promotes the transport of the glucose. Glucose entry into the adipose tissue similar to the effect on the muscle cell. A portion of glucose is converted into alpha glycerol phosphate, and alpha glycerol phosphate provides the glycerol backbone for triglyceride synthesis, and fatty acid from the liver that are here. These fatty acids via lipoprotein, they combine with glycerol, and they form triglycerides or storage form of the fat. Without insulin, storage of the fatty acid in the adipose tissue is impaired, and as glycerol synthesis is limited, this leads to elevated fatty acids in the blood, a hallmark of uncontrolled diabetes mellitus. So insulin plays a dual role. It prevents first the breakdown of the fat, that is lipolysis, and also promote the fat storage, that means lipogenesis in the adipose tissue. In the normal state between meal, when the insulin secretion is naturally low between the meal, the body shifts from glucose to fat as primary energy source. So this occur because low insulin level favor fat breakdown, that is lipolysis. In diabetes mellitus or other states of insulin deficiency, lipolysis is greatly enhanced due to the lack of insulin inhibition. So fatty acids are released uh, into the bloodstream. The body relies heavily on fat for energy production. So the excessive fat breakdown leads to elevated blood fatty acid. Uh, Increased fatty acid oxidation in the liver leads to production of the ketone bodies that can result in ketoacidosis in severe cases. And long term, this abnormal fat metabolism contributes to atherosclerosis and vascular disease. So the insulin acts as a regulator to limit fat breakdown. When it's absent, the body switches to fat as the main energy source, often leading to metabolic disturbances. In the absence of insulin, all fat storage promoting effects are reversed. Hormone sensitive lipases that are normally inhibited by insulin become strongly activated. Activated hormone sensitive lipase, they now in the adipose tissue they hydrolyze triglyceride and form fatty acid in the adipose tissue. The fatty acids and these triglycerides are hydrolyzed into fatty acids and glycerol, and they are transported into bloodstream. These fatty acids, they are transported into bloodstream, and plasma free fatty acids are markedly elevated as a result of the release from this. Within minutes after insulin deficiency, they become highly increased, and these free fatty acids become the primary energy source for most of the tissue except the brain, which still requires glucose or ketone, glucose for the energy or ketone during severe deficiency. So, without insulin, fat breakdown dominates energy metabolism, leading to elevated free fatty acid and ketone production, which can result in ketoacidosis in condition like diabetes mellitus. This graph is showing the changes in the blood glucose, free fatty acid, and acetoacetic acid concentration after the removal of the pancreas, illustrating the effect of insulin deficiency. On the x-axis, there is a time in days, and on y-axis, there is concentration of these compounds, these molecules in the blood, glucose, fatty acid, and acetoacetic acid. So there is a vertical dividing line that is showing the removal of the pancreas, the or the end of the control period. After this point, the subject is depancreatized here, meaning no insulin is available or no insulin is secreted. So the blood glucose initially is stable during the control phase, and it rises sharply after the removal of the pancreas. There is sharp increase after the removal of the pancreas, continuing to increase over several days due to lack of insulin, which normally facilitates glucose uptake. Then this blue line, it is showing the free fatty acid. It remains at a moderate level during the control phase over here, during the control phase, but it spikes almost immediately after the within minutes after the removal of the pancreas, and due to increased lipolysis it is increased and then plateau at high level. Then there is acetoacetic acid, this green line, very low during the control phase and rises progressively after pancreas removal from day 1 to day 4. It rises progressively, indicating increased ketone body formation due to excessive fatty acid breakdown. So, after insulin is lost, blood glucose and fatty acid rise and ketone body level increases, reflecting a shift to fat as the primary energy source and the risk of ketoacidosis. Insulin deficiency leads to increased lipolysis, releasing large quantity of free fatty acid into the bloodstream. The liver converts these free fatty acids into phospholipids, cholesterol, and triglyceride, which are these triglycerides are packed into lipoprotein. Excess lipid products that are cholesterol, phospholipid, and triglycerides are released into the blood as lipoproteins, and plasma lipid level can reach up to 3 times of normal values, reaching a total lipid concentration of several percent, which is normally 0.6%. So, this high plasma cholesterol is a major factor in the development of atherosclerosis, significantly increasing the risk of heart attack, cerebral stroke, other vascular complications, especially in people with severe diabetes mellitus. So, insulin deficiency it doesn't just affect glucose metabolism, it profoundly alters lipid metabolism, leading to hyperlipidemia and vascular disease risk. Excess fatty acids are released from the adipose tissue due to lack of insulin. The carnitine transport system in the liver becomes highly activated, moving fatty acid into the mitochondria, and beta oxidation of these fatty acid in the mitochondria produces large amount of acetyl CoA. And when acetyl CoA accumulates beyond what can enter citric acid cycle, it condenses to form acetoacetic acid. And acetoacetic acid is released into the blood and partly converted into beta hydroxybutyric acid, acetone. And these three compounds are collectively called ketone bodies. Peripheral tissue converts some acetoacetic acid back to the acetyl CoA for energy. However, without insulin, utilization of acetoacetic acid is impaired, causing it to accumulate in the body. Ketone body level rises significantly, that is termed as ketosis, and also there is development of acidosis. The excessive acetoacetic acid and beta hydroxybutyric acid acidify blood fluids, leading to metabolic acidosis. Severe cases can lead to diabetic ketoacidosis that result in coma and possible death if untreated. So acetoacetic acid level can rise up more than 10 milliequivalent per liter during severe insulin deficiency, and fruity smell or ketone odor that occur in the breath is due to acetone. Hence is also termed as acetone breath. Thank you for watching this video. If you have any query, please write in the comment box.